My Lords, safeguarding people experiencing suicidal ideation or mental health crisis is a priority. We recognise the growing use of generative AI chatbots and the potential risks that they can pose, particularly when people seek support during moments of acute distress. Where the content is created by AI or humans, the Online Safety Act places robust duties on all in-scope services, including those deploying chatbots, to prevent users encountering illegal suicide and self-harm content.
My Lords, ChatGPT is giving British teens dangerous advice on suicide, eating disorders and substance abuse. A report from the Centre for Countering Digital Hate found that within 2 minutes, the AI platform would advise a 13-year-old how to safely cut themselves. Within 40 minutes, it would list the required pills for an overdose. And after 72 minutes, it would generate suicide notes. Can my noble friend the Baroness confirm that Ofcom will treat ChatGPT and other chatbots as search engines under the Online Safety Act and assure the House that the regulator has both the powers and the will to enforce the Protection of Children Code when it comes to generative AI platforms such as ChatGPT?
Yeah. It is a disturbing situation that my noble friend describes, and I can indeed say that the independent regulator, Ofcom, has made it quite clear that if an AI service searches the live internet and returns results, it will be regulated under the Online Safety Act as a search service. And yes, Ofcom can take robust enforcement action, including issuing fines of up to £18 million or 10% of qualifying worldwide revenue, whichever is higher.
My Lords, I declare my interest as Chair of Team Domenica. The group who most need safeguarding from these AI chatbots are those with learning disabilities. In Brighton and Hove, we work closely with the police who train our candidates how to be safe online. Would the Noble Minister agree to consider special training for police and social workers to protect this highly vulnerable and suggestible cohort?
Well, I do understand the need for training, as the Noble Lady rightly outlines, but I would emphasise that AI chatbots are in scope of the Act, as I mentioned just now to my noble friend, and what matters is searching, the fact they actually do searches of the live internet. But what the Noble Lady does raise that's very important is also about literacy in terms of using the internet, equipping individuals to try to stay safe, but safeguarding those who are more vulnerable, as she describes, and certainly training is part of that.
I've consulted ChatGPT on this. It calls me Dear Ruth, and it says that when people write to it about suicide, it responds with empathy and compassion. It does not encourage suicide, and it sends a guide to human support. So I don't want to make light of this or condemn it outright. On the contrary, I think there may be something to be said, certainly at a light level, when unhappy people consult ChatGPT. And I don't want to discourage or limit freedom of speech any further than it is already limited. There may be some help for people in ChatGPT.
The Noble Lady makes a helpful challenge, I feel, about how to regard AI services. And perhaps I can say that whilst generative AI can indeed offer opportunities to enhance mental health support, and the National Health Service is looking at how we can, particularly through the NHS app, assist and support people. Such technologies must not replace trained professionals, including in crisis situations. So it is about getting the right support at the right place at the right time, and that is a delicate balance, but we should use AI for its great benefits.
My Lords, following on from the previous question and drawing on international best practice, Will the government look at what it can do to mandate that all general-purpose AI providers implement a prominent, context-sensitive hard stop and clear immediate signposting to UK mental health services when a user's input suggests a high-risk mental health keywords or suicidal intent?
Yeah. I think the Noble Lord makes a very useful suggestion, and I certainly shall raise that with my ministerial colleague at DCIT. And I do note that companies, admittedly, they're doing this when under pressure, but are looking at introducing, for example, age assurance functionalities and ensuring that users do get the right experience for their age. But we shouldn't be leaving that to chance, and we shouldn't be leaving that to the fact this is arising following legal challenge. But I certainly look forward to looking into the point the Noble Lord makes.
My Lords, is there an analogy with drugs here? A potent technology which has great and positive uses in healthcare, but also a potent technology that can be abused. So it must be properly regulated, and some uses must not be allowed without prior approval. Some should be banned.
Well, my noble friend is right that that this can be used for good or for ill, and of course there are other comparisons to draw. But again, I do want to emphasise that and my noble friend hasn't said this, but I want to make sure we keep away from this, that AI services are not escaping regulation. And many AI chatbots are certainly in the scope of the Act. And I also would take the view that AI actually can assist us greatly in supporting those who are at risk, and certainly in improving health. And we seek to harness that as we move from analogue to digital as per our 10-year plan.
My Lords, can I start by thanking the Noble Baroness Berger for bringing up this issue and making Noble Lords aware of it. My Lords, with evidence that people with mental health issues are increasingly turning to AI chatbots rather than to health providers, and rather than simply relying on the stick of the Online Safety Act, can the Noble Lady the Minister explain what conversations her department, perhaps in conjunction with DCIT, are having with AI companies and with UK AI, the trade body, so they could come together to find a solution for safeguarding? So when, as Noble Lord Scrivener and the Noble Baroness Lady Deitch have said, and perhaps they could suggest how to deal with individuals in distress who go to these chatbots, and to make sure they are signposted to appropriate services rather than offered content that encourages them to take their own life.
Well, I would certainly agree that is indeed the way that we need to go, and discussions do happen regularly with companies, as the Noble Lord says. It probably is also worth saying that we have already seen some early signs of improvement in terms of protection for users from online harms, and over 6,000 services are implementing what we would regard highly effective age assurance, which does bring protection to millions of children. And I would also make the point that, of course, DCIT is monitoring and evaluating the Online Safety Act, and where evidence does show that further intervention is needed to protect children, we won't hesitate to act.
My Lords, digital mental health technologies with clinical purposes are classified by MHRA as medical devices. So what action can the government take, working with MHRA and Ofcom, to ensure that these chatbots actually promote suicide prevention policies and do not act as suicide promotion sites?
Well, the first thing is to ensure the application of the Online Safety Act, and we look to Ofcom in that regard. But we will actually increase access to evidence-based digital interventions, and the reason for that is to help patients access treatment in a variety of ways, but also potentially reducing unnecessary GP appointments and A&E attendances, as well as assisting people who are waiting for treatment to wait well.
My lords, isn't there a wider lesson here that many young people are turning to ChatGPT instead of calling their GP for health advice? And has the government reviewed how they communicate different health information, particularly to the younger generation? And are they talking to the younger generation through the channels that they are using?
Yeah.
Although sadly I can't say I'm young myself, so I can't testify to this, but the answer to that is yes. Indeed, the department does do that. But I would refer to the point the Noble Lady is emphasising, actually, that I mean over a third of 5 to 7 year olds are using social media in 2025. And that's rising as young children get older. So we ignore this at our peril, but I can assure the Noble Lady that we are not. The Online Safety Act is providing support, as well as the digital interventions that we are providing through the NHS, and in particular the improved NHS app.